Welcome to Starkey Sound Bites. I'm Dave Fabry, Starkey's Chief Hearing Health Officer. It gives me great pleasure to be today with Owen Olende, Starkey's Vice President of Sales for Africa and Latin America, and Michele Walsh, UNICEF USA's Executive Vice President and Chief Philanthropy Officer. We're going to talk about the partnership between Starkey and UNICEF and Starkey's support of the UNICEF Children with Disabilities Fund. Now, UNICEF is an organization known to baby boomers like myself because it was formed back internationally in 1946, coming out of World War II, and was primarily dedicated to providing support for children, many who were orphaned in World War II. But boy, have you been busy since then. And Michele, I really appreciate your being with us today. And I thought maybe we'd start by talking a little bit about UNICEF and UNICEF USA, and maybe lead in a little bit to this partnership that we have between Starkey. Now, we're the inaugural partner, I believe, for this fund. And so talk a little bit about the background and your experience as well with UNICEF.
So as you said, UNICEF has a long history. Most often what people think about is they think about what you just summarized and coming out of World War II and our inception. The other thing they think of is trick or treat for UNICEF. Many people trick or treated. I see lots of nodding. Yes, we often get that response. We still do that. And then the other thing that people think of is humanitarian response in a natural disaster. So we've all seen earthquakes and other spaces, and we do that. It's an important part of our work, and we're able to respond very quickly in those circumstances when children need us urgently. But I think what's surprising is we're actually in 190 countries operational. So when you process like a globe and you think about it's a pin almost everywhere on the
But it's easier to say which countries you're not in than it is to try to name all of them.
Exactly. So we have a huge footprint, but we're not doing that alone. We're working with partners, we're working with governments, really to make sure that we're navigating to really serve children, make sure that they have a chance to be healthy, educated, protected, and respected. And that those are huge umbrellas. It's really a holistic approach to what children need to be able to survive and thrive in the world.
Yeah, and I think one of the things that's interesting too is, if I'm correct on this, that UNICEF, for these relief efforts, it's not funded out of the UN general budget. It's funded out of non-government and government organizations.
That's true. We actually get $0 as part of the UN, and that was actually the condition that allowed us to be founded initially. It was that it was at the will of the people. And so it is something that we take very seriously in terms of mobilizing that will and the public interest to make sure that we are working towards the best interest of children everywhere. Whether it's here, whether it's somewhere else, every child has a chance at that opportunity for life and has a right to it, really.
Well, and I think that meshes so well with Starkey's purpose, really, since we were founded in 1967 by our founder, William F. Austin, whom you know and gotten to know over time here. But, they have been so focused on the mission of one element for us. Hearing is our concern, and also I only half-kiddingly say, so the world may hear, was Bill Austin's mission. And I think he single-handedly wants to ensure that every person around the world that suffers from hearing loss and cannot have access to professionals or technology that enables them to be fitted, he's going to do what he can, and he certainly has done so, providing millions of hearing aids around the world. But really, in this initiative, which is in Starkey Cares, Owen, you've been central into your involvement in Starkey Cares, and through your work in the continent of Africa and also in Latin America, you've had a front row seat to all of this. And really this mission is aligned with our purpose as well. Talk a little bit about your background in the 8 years that you've been with Starkey on the business side, right? And then also even longer working in other elements with Starkey.
Absolutely. So I'm passionate about hearing, and I consider myself a global hearing health advocate. And, since I joined Starkey, and I've been working with the Austins and Starkey for over close to 20 years now, and it feels like just like yesterday. One thing about hearing is it's one of those disabilities that people don't talk about. And I'm going to start from that element as I build up onto the next. If you look at the numbers that the WHO has published, when you talk about close to 1.5 billion people with some degree of hearing loss, and then about 431 million out of that 1.5 million with disabling hearing loss. That's a huge number.
Incredible.
And if you think about where the prevalence is, we're talking about 80% of the disabling hearing loss in the low and middle income setting countries. That's a big problem that, partnerships and through Starkey, we've been working on ways we can help deliver on how we can support that. So meeting up with Bill and Tani, close to 20 years ago, was actually a blessing to me because we share the same purpose, which you just talked about. Bill built Starkey on the premise of "So the world may hear." And there's also one thing that he actively always preaches, which is alone you can do much, together you'll change the world. And together with Tani Austin, they've been major advocates in spreading out the gospel of better hearing and providing the gift of hearing, not only by providing hearing aids, but also building systems and creating sustainability when it comes to hearing healthcare, with a specific focus on community-based hearing healthcare in the low and middle income setting countries.
It's such an important point. I mean, thinking about like the systems and the infrastructure, it's the only way you really do something like that at scale. And I think it's part of why it's been such an exciting conversation.
Yes.
Because I think you have a real unique understanding of what that means at scale, but also what it means in community for one person.
Absolutely. Thinking of Starkey as a company, of course, we're a leader in technology and building the best in when it comes to hearing devices, but we also support those in need in the low and middle income countries. Bill and Tani, through partnerships, have been able to develop unique systems in the community-based model, which is supported and built on the WFA model, which has helped governments, partners such as yourself, and also local leaders adopt community-based hearing healthcare models that are more sustainable in supporting the communities that they live in.
Because you can't do it alone. I mean,
No,
I think
you
that's
don't.
why we're talking.
Yeah.
But, yeah.
And before we dive into the topics that we want to discuss, I think one thing, looking at a North American perspective on hearing loss, we often talk about the fact that stigma is the biggest barrier to use because many times people think that hearing loss is something that only afflicts older people, like myself. And we tend to think of it as something that is an obstacle to overcome in that way. But, talking a little bit, just let's isolate Africa for a moment. Mm-hmm. In many cases, hearing loss is a pediatric issue in many cases in emerging and low-income and developing countries because of malaria, HIV, AIDS, other diseases that impact across the age spectrum. But as we talked about before we began with this, my first visit to Africa in volunteering with Starkey was to Uganda, where I was alarmed to hear that the life expectancy of a Ugandan male, and this was 15 years ago, was about 46 years of age. They didn't even get old enough to develop presbycusis, or aging of the ear. I look at an additional issue, as staggering as the number that you said, and the number of people that WHO categorizes with hearing loss, it's going to get even bigger as we start to see improvements in some of these emerging and developing countries in overall quality of life, raising the life expectancy, because people didn't live long enough to get presbycusis. Now they will. And so hearing loss is a global health concern that connects all of us. It should be a concern on the pediatric end and on the geriatric end of things. But now transitioning into this partnership between UNICEF USA and Starkey, can you both talk a little bit about where we are with this? And we're just kicking off this partnership, but talk a little bit about what we're doing so far.
I think maybe before we go there, one of the things that I often think about is like, why is there an organization that focuses on children holistically? Because there are very unique needs. Hearing loss, it doesn't limit itself to children, as we know, and as you just talked about. But I often think about this, like if an earthquake struck right now, and we're sitting here, and let's hope that doesn't happen, but it will strike somewhere at some point. What would you do? And I actually just like, as a human, think about that for a moment. What would you do personally? And I think of all the people I love, and I would figure out where they are and make sure they're okay. I would think about my children before my husband, not because I care less about him, but he's an adult.
Right.
And the context is different for children. They are uniquely vulnerable. They're in a developmental phase of life. There are things that land differently. The stigma is different. They process it differently, access to education. And so there really is a unique context for children that is critically important. And so I think as you talk about that and thinking about this partnership, I think it's a really important distinction as we think about how we have interventions that meet the unique needs of children and adolescents as it relates to hearing loss and disability and community and the stigma, like all of it, not just the
Absolutely.
medical side, but like what does it mean for the totality of their life to be able to have interventions like this? It's life-changing.
Such a powerful way
Yeah,
to
in so many
characterize
ways.
this.
It is life-changing. And going back to the numbers that I mentioned earlier, I mean, out of the 431 million people estimated to have some form of disabling hearing loss, 34 million of them are children, right? And if you talk about 80% of that in the developing world, then that's a bigger problem, because if you think about the next generation, if 34 million people have disabling loss when they're children, then that is something that adds up into lack of, education
lack of
and
ability.
systems, and of course it affects economies all around the world. So WHO also came up with some numbers on the economic effect of disabling hearing loss. The estimates of about $980 billion lost due to untreated hearing loss. If you think about the future generation, or the children that we are focused on right now, if majority of them don't have the early intervention from an early age with assistive devices or just basic screening, then we are overlooking a very important aspect of our society.
And compounding something.
It compounds
That
and it
is-
characterizes
yeah.
down the road,
Yes.
like you said, in so many ways: socialization, economic factors, just distress for families, because if children in particular are so vulnerable, if you don't identify and then intervene with amplification at a young age, you miss critical life periods that impact speech and language development permanently.
Permanently.
In cases.
And unfortunately, in the low and middle income countries, they have other priorities that, of course, supersedes the priority of early intervention and newborn screening. And we, in partnership with UNICEF, are engaging stakeholders globally to really promote the involvement of professionals in country and governments to buy into setting up early intervention policies. And this need to be built into the national health structure, whereby that every single child that is born in any country needs to go to some form of screening.
100%.
Said.
And that helps identify and intervene at an early age so we don't run into the problems that we currently have.
Okay, so
And
we
I
have
think-
characterized
yeah.
global health problem,
Yep.
and then this initiative, which seems so near and dear both to UNICEF and to Starkey's heart.
And I think, as you just said, right, there are other things on the horizon, and I think it's very easy when you look at urgent needs to sort of push this out of the spotlight. But it really is such a critical issue. And so UNICEF, you were asking about the partnership. UNICEF identified the need for a global fund that was focused on disabilities,
Yes.
and that's sort of in totality. And we started to really think about, like, where would we start? And this year, we were able to launch this fund. And as an obvious space, it just seemed like a perfect inaugural partner as we thought about some of the conversations we had had with Starkey over time. And I know you were sort of right there from the beginning.
Oh, yeah.
Yeah. So, as being on the radar and thinking about some of the ways that we were aware of Starkey and your contributions, it was just an incredible moment to really launch something and bring resources and visibility to an issue that matters, I think, for all of us.
Yeah.
And just to add on to that, our first interaction with UNICEF was actually in Uganda in 2018, whereby we worked together with the World Bank and the Global Education Program and the Ministry of Education then in Uganda to create a hearing healthcare program that supports schools for the deaf. And it was quite successful. And to date, we still have the infrastructure in place, despite the disruption from COVID. So, that interaction with UNICEF was at the beginning of the conversation that we had that led to this new partnership. And it was a no-brainer because, as you mentioned, UNICEF has global footprint in over 190 countries. Starkey does business in over 100 countries. And we consider ourselves the experts in community-based hearing healthcare models. And, through our WFA model that was developed by our founder, Bill Austin, we've been able to build systems that are actually viable for the setting that it's meant to be. And it's very dynamic.
Right,
It's
not
different
not
from one
delivering a
country.
solution.
Exactly.
Yeah.
It's
Building it.
dynamic. It fits into the setting that it's meant to serve.
And I think that's a really critical point, building systems that will sustain, especially at a moment where we're feeling lots of shifts, whether it be in supply chain, but the system infrastructure in the right system infrastructure in the right context, and really building the demand at the community level and at the country level is something that makes it sustainable. And then you start to see the investment and the buy-in from the local community to really make it something that's going to have legs.
Yeah, and the one thing that UNICEF and Starkey shares is we take our time to understand the needs of the communities we serve. And we build the programs around that. And that's what real sustainability is, because we're not only giving them fish, but we're teaching them how to fish.
Yes.
In
Building
their
them
own
with
context.
the community. not
Exactly, with the
for
community
community.
involvement.
Yeah.
Absolutely. It has to be ingrained.
And it's a bottom-up approach.
Yeah.
So with regards, Owen, talk a little bit about Starkey Cares in this element in terms of what was the catalyst for us signing on and how this contributes to our corporate culture of giving within the Starkey Cares company.
Absolutely. So Starkey Cares is our corporate social responsibility program within the company. And it's, again, built on the same promise that the Austins started the company on, is alone we can't do much, together we can change the world, and so the world may hear. So our culture of giving, starts from the beginning when Bill set up this company. And I speak on behalf as an employee of this company, that mission and vision and purpose lives within us. Because every single initiative that we're involved in through Starkey Cares or other initiatives within Starkey, even on the corporate side, on the business side, is geared towards one goal. So the world may hear, regardless of which part of this world you're in or what your needs are. If you can't afford it or cannot afford it, we will provide the care that's needed. Yeah. Because as Mr. Austin always says, if you need hearing healthcare, you should be able to get it. Yeah. It's a basic right. Mm-hmm. So for us, the partnership with UNICEF through Starkey Cares was a no-brainer. And the Austins who actually pioneered this arrangement was like UNICEF with its global footprint. We share the same values. It's just a no-brainer for us to come together and leverage the resources that we have to really promote something that has been overlooked for very many years, to engage all the right stakeholders to help move where we currently are into the next level. So as we're expecting 700 million people with disabling hearing loss by 2050, we should be able to cut that by half. Through building the partnerships, early intervention, and making sure that any child who can be screened when they're born or get the right necessary intervention and assistive devices when they need it in the setting that they're in.
I mean, as I've written a lot about like what successful partnerships are, I've been in the philanthropy space for a long time. And I think when we take the time to have values alignment, we have partnerships that they're just magnified in a way that is really palpable. And I think like just even the language that Owen uses of talking about hearing as a right is something that we believe at UNICEF as well. It's not a gift. It's not something that we think someone should get. It's something that they have a right to have.
Basic human
right. And so some of those values, and I think in every conversation that we've had with Starkey, we can feel it infused in how this entire team shows up. Every single person that we've interacted with Starkey, you can feel the values at the core. And I know that comes from leadership, but it comes across the board. And we feel that. And I think because of it, we are having the right conversations about that.
Absolutely.
And it doesn't matter whether we're talking about U.S. or, we're going back and forth. The goal is the same.
Yeah.
Hearing is our concern, so the world may hear. And we're thinking and going back and forth between global and U.S.
And as you said, you were just saying, right, the landscape is different and we engage differently in the right context, but the charge is the same.
The charge is the same, and Owen's passion is felt by everybody that has been inspired by Bill and Tanny, and regardless of where we're, the 5,000 or more than 5,500 employees that are around the world share that central vision. And we all want to help. And when we focus and we think about the U.S. market, so now we're a very wealthy country in comparison to the rest of the world. And yet in the U.S., we still see there is a need. There are children that are falling through the cracks. We look at the changes in some of the social benefits programs and some of the expectations for that basic human right of hearing from the moment a child, in virtually every state now, we have the expectation that if a child is born in a hospital, they're going to be tested. And before they leave the hospital, we have at least an indication as to whether there is a hearing loss present or not. But then that doesn't guarantee that screening that is done at the hospital still requires follow-up. And still, in many cases, going in and having that child tested for the first time, and I can tell you as an audiologist, having to have that discussion with a parent about failing a screening doesn't necessarily mean that there's hearing loss, but you're, for the first time, confronting the parent about the possibility of a disability. No one wants to hear that. And but
I've been that parent.
And
navigated. And I
through
think
that.
part of it is, right, here we often have the resources and the pathways, not always, but as we navigate that at a different scale. But then, we're doing this work in Uganda, Peru, and India to start in this partnership. And, you look at a 16-year-old girl who has gone her whole life and is completely silent, right, for something that an intervention could address.
Absolutely.
And so, through the program, being able to bring in the screening piece, the stigma piece, the assistive technology, it's just life-changing.
Yes.
I mean, I don't have to tell all of you, I know,
Yes,
but,
it is.
but it just to see it firsthand and experience as a parent, like what I'm able to do and the resources that I've been able to have to advocate for my daughter and to understand and to go on that journey. And at the same time, realize that another mom who wants the exact same thing for her daughter doesn't have that without this type of an intervention. And she has the same right that my kid does.
Exactly. And then importantly, people just think, oh, well, we've got newborn hearing screening, so tick off the box. No, it's not the screening. The screening is an essential first step, but intervention is perhaps more important because the longer the delay, the longer the ultimate delay in speech and language development.
Yeah.
So can you talk a little bit
about social, exclusion is a real thing.
Exactly, yeah.
We worry about the stigma at the opposite end. We talk about in the aging population how we're isolated and loneliness and depression and ultimately leading in some cases to cognitive impact. Well, on the front end, it's exclusion in that case too. And so talk a little bit about some of the early wins, if you will, in the early stages of this partnership and of this program.
So it's really we are in early days, and I think there are 3 different things that we're trying in each of the different countries. You talked about screening. We're screening in Peru. I think we just screened 200 newborns, which is just, again, the idea is always going to be to scale that up, to see how it goes, to learn in the country context. In India, there's a huge focus on stigmatization and how we can do some of the behavior change. Have seen really good results as we're starting to roll that out. Those are sometimes slower, as you probably know from all of the work that you do here, but they can move the needle in huge ways. And then in Uganda, where we've talked about sort of where it all started and where I think each of you have had different experiences, we're continuing to do some of the work and the intervention work as well and bringing in the screenings all the way through to the actual interventions and if appropriate assistive technology.
Yeah, and every country has a little different
context.
Need. I think about with some of the volunteer work that I did on the foundation, where we'd go in and it's just changing the name of the school for the deaf. So many times we would go in and some of these kids who were in a school for the deaf really only had a moderate degree of hearing loss, but they were using sign language rather than spoken language because there was no infrastructure to assist them in providing that movement from screening to fitting and moving on from there. And then I think the stigmatization, is a very important element as well. And it's not only for the child, but for the family. Because I can tell you there are times where a hearing aid it's the solution, part of the solution, but it can be part of the problem in some cases with the stigmatization where the parent assumes that now that they have amplification, everything is going to be resolved immediately. And so addressing that expectation and the stigmatization is an important element, and I'm really glad to hear that you're doing that work.
Part of that is training frontline health workers,
Yes,
right? I mean, we're all sitting here, right? We're not in front of the kids, and so making sure that the community in and of itself has that training to be able to not just diagnose, but to help in that full journey.
Yes.
And that's been a big part of the work. Yeah.
It's a holistic effort. And we're talking about not only the training of all levels of people, including the community healthcare workers, but also promoting awareness and policy change. At the end of the day, you have to realize that the reason why we have those cases of children with mild to almost moderate hearing loss in deaf schools is because the system let them down. We don't have policies in place that promotes proper screening before they're placed into those deaf schools. And Starkey has been at the forefront of changing that system. Working with the ministries of education, working with the Ministry of Health, Social Services, we're able to create that awareness on the importance of early screening, done the right way, and immediate intervention, again, done the right way, and then placing them either in a inclusive school or normal school, or then the ones with extreme high severe hearing loss, then we'll go to what we consider the deaf schools.
I think that's one of the things that's most often overlooked as an incredible value. It's easy to look at government and think like, oh, what's the role of government in these types of solutions? But the reality is government budgets are much bigger than our budget, much bigger than your budgets. And so if we don't bring them along, there's not really, they're the ones who have to firm up the infrastructure and build that within country. And so the way you talk about the role of government and the ministries that are really effectuating that is incredibly important. And it sounds not that sexy, but I think it's like what goes from like a small project to something that really goes at scale.
Absolutely, and you talked about the deep pockets of the governments. They do have the money. It's just they don't. Sometimes their visibility is limited. I mean, we know with hearing loss, you don't bleed. It's not fatal. So in most times, it's considered irrelevant or not that important compared to communicable diseases or life-threatening diseases, which a lot of the developing countries face. So if you teach a government how to focus and appropriate their budgets accordingly, that adds a lot more effort. And of course, working alongside them is another way of training the system to adapt more policies that are more sustainable and long-term.
And I think you should give, I give Starkey incredible credit. Like, it's very rare that I have a partner who can articulate it better than we can in terms of the role of government. I think you really fundamentally understand the way that it operates and the way that we can be successful. Often partners sort of look to us to build that out, and we're coming in with like shared expertise that is really, really valuable and a deep commitment.
And we have to put them at the forefront. They have to take charge. For them to have that full ownership and control, they have to take charge. And that's been our experience.
You come in with the knowledge
exactly.
and help bring that along.
And I wouldn't say we come in with the knowledge.
Fair enough.
We come with the knowledge, but we understand what the setting is like and build the knowledge based off that.
You're building
it's custom made for each and every single country and setting.
Well said.
Yeah, I think that's the most important element, is that across the world, it is the 190 countries and more than 100 countries where we're doing business. It's understanding each of those are uniquely, it's a mulligan stew. It's not a melting pot. And everyone has unique needs, and understanding that is why, again, you're both passionate about this, but it just feels like there's already in the early days of this partnership, a real meshing of the passion and the knowledge and the expertise to really focus on this. And so, we're entering into the holiday season now. And so how important are partnerships and corporate philanthropy in terms of driving this initiative, and how do people get involved if they want to contribute to this?
So I think it's important all year long, really candidly. And I think we've talked about that a lot, and really deep partnerships often are ongoing. But there is a special energy around the holidays. I think all of us in our own lives, we're thinking about how are we going to give a little bit more? How are we going to take care of the people we love? Whether it's time or gift lists or whatever you're doing, right? And I think people are thinking that way, and it's important to really bring that moment. And certainly in the nonprofit sector, it's not a coincidence that a large share of giving from people happens in December. A really significant portion of that. And so I think it's just a moment that you can reflect and think about something small can make a huge difference in someone's life. We're talking about huge numbers, we're talking about things at scale, because they're smart and effective and efficient solutions. And that means that every little bit incrementally adds to that. And it reaches 2 more people, it reaches 5 more people, which sounds, again, but if it's your kid, that 2 extra people or those 5 extra people. And so I think it's just to do the same work, to reflect on your own values, to think about what matters to you. It's a good moment to do that. I always do that at this time of year myself. Endorse or amplify, right? Whatever you do year round.
Amplify it during the holidays. And so we think about it, and I would ask, people listening to this podcast, thinking about as you're gathering with your family and your friends and your children or your grandchildren, in my case, thinking about the way that we're connected. Helen Keller is the patron saint of most audiologists, because she unfortunately suffered from both blindness and deafness, profound loss of both vision and hearing. And she says that while vision brings in connects us to things, the beauty of things, hearing is what connects us to each other. So as you're celebrating around the table during the holidays, or and however you celebrate, thinking about those little moments of joy that are connecting us to each other, and how it is that hearing loss impacts that, especially if it's untreated. And so are there ways to contribute to this effort?
I would say a lot of our supporters came to us at a moment and share what that moment was for them. And often it is around the holidays, but they've stayed with us. So whether it's going to our website, I mean, I could do our usual, you go to UNICEFusa.org, you can make a gift, you can make a monthly gift. And please just, again, think what matters to you. Think about your values and the purpose and the impact that you want to have, and be as generous as you can, because those small bits make a huge difference in really, not charity as we were talking about, in helping children realize the right that they have is really incredibly powerful.
One thing I'll add is, of course, in promotion of giving, UNICEF for us was a no-brainer to support. I mean, as an inaugural donor to the Children's with Disability Fund, it only made sense because of the work and the reach that they have in the community level. Of course, I would encourage people to go to the website, see the work that's being done, because there is a huge need for intervention when it comes to hearing health. And however little it could be, will go a long way in supporting a child somewhere in the low and middle income setting get the necessary screening and intervention they need so that they can have a brighter future.
That's well said. And I think we'll end there unless you have any final words regarding the partnership, regarding the mission, regarding the early days of the collaboration between these two entities.
Maybe just to restate, I think the deep values alignment that we have with Starkey has been inspiring, and I think gives us a lot of hope for how we go on this journey through the future.
Absolutely. And we're excited as Starkey and partnership with UNICEF, and hope our partnership will scale up so we can make a bigger difference in the short term and the near future.
I have no doubt with the two of you and the passion that you have for this. And as you said, the alignment of values. There's no greater partnerships. The partnership strength is really predicated on the shared values of this for seeking out and providing assistance for children who suffer from hearing loss with this, in our case, and with everything else that UNICEF is doing in the U.S. and around the world to help children. So thank you both for being here for this very engaging conversation. And for our listeners, if you enjoyed this episode, please share with your friends, people who might benefit from hearing about this partnership. And we look forward to hearing and seeing you again really soon, and amplify the role of hearing during the holiday season.